Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I am going to discuss a recent review article which is titled Stem Cell Therapy in Dermatology, Its Challenges and Opportunities, which is published in the Indian Journal of Skin Allergy, published by Scientific Scholar. Now, to talk to us about this recent review, we have with us today the lead authors of the study, Dr. Disha Chakraborty and Dr. Abhishek Day, who are from the Department of Dermatology, Calcutta National Medical College and Hospital, West Bengal, India. So, welcome to Medical Dialogues, both of you. It's really a pleasure to be having you on board here with us today.
Hello.
Thank you. Hi.
Great. Now that we're talking about your recent review article, to start with, Dr. Disha, if you can just let us know what is stem cell therapy and how is this evolving as a therapeutic choice across different disciplines?
So I'll make it easy. Stem cells are unique cells. They have properties of self-renewal, regeneration, immunomodulation. So stem cell therapy is just a branch of regenerative medicine which utilizes these cells to repair damaged tissues. So our focus was mainly stem cell therapy in dermatology. So we elaborated about its use in chronic wounds, autoimmune skin diseases, vitiligo, skin rejuvenation. Previously, it has been mainly used in hematopoietic cell therapy, but our focus was mainly dermatology.
Great. Now, Dr. Abhishek, if you can just kindly elaborate your findings about the application of the stem cell in dermatological treatment and research.
Excellent. So, as Disha already elaborated, that our main focus was on basically in dermatological condition. But I must just a little bit add, its application has now found beyond dermatology, like in neurological sciences. It has been used in Parkinsonism and multiple sclerosis. In case of cardiology, it has been used in myocardial regeneration post-infarction, like after the infarction, the myocardium is really bad, and the stem cell has been used to regenerate the potential of the myocardium. And then in oncology, it has been extensively used for targeting the cancer stem cells. And also there are other conditions where it's been finding its uses. But in our study, we had done extensive, researches, reviews of the entire data available from all the published data and from the phase 2 and phase 3 studies, and also other data to find out that there are basically mainly 5 areas where we are having extensive use in dermatological research. One is that autoimmune and autoinflammatory skin disorders. Then comes the genetic skin disorders. Then comes the wound healing and skin regenerations, aesthetic and anti-aging applications, and also hair regeneration. So these are the main areas of interest we have been finding. So I'll start with the autoimmune and the autoinflammatory skin disorder because that is kind of area of our focus, our research. And there are few diseases where it has already been found effective. First of all, I must talk about the pemphigus vulgaris, systemic sclerosis, and chronic urticaria. This is the areas where mesenchymal stem cells and hematopoietic stem cells have been using to not only modulate the immunity but also enhance the tissue repair. Another areas of my focus of research is atopic dermatitis. I've been working extensively on these areas, and if you see me and Disha together publish a lot of articles along with those. We have a book on our name. So here also have been finding very interesting use of mesenchymal stem cells. We'll come and elaborate that a little later. Another interesting areas of autoimmunity is lupus erythematosus. Now, lupus erythematosus is one disease which is almost incurable in dermatology. It's like autoimmune conditions. Again, the mesenchymal stem cells gives us options. This has a potential cure-like use. Though it's the very early days of the research, but it's modulate the immune responses, reduce the autointermediate formations, and the most important and interesting thing that is also improve the renal function. Now this is very intriguing because the kind of uh, therapeutic options we have. There have been some immunomodulator we've been using, but nothing was good enough to improve the renal function, and that's such a poor thing for a patients of SLEs. Now this has a lot of impact, like it induces remissions, decrease the proteinuria of renal functions, and also increase the regulatory T cells. So this is very interesting, and I think this is like a pole position in if there's something called curative treatment in SLE. However, there are challenges like strategy thing, ethical consideration, and even chances of infection. Those needs to be kind of sought out. Second thing I must say, there are some incurable genetic disease. Now one most important thing is epidermolysis bullosa. Again, I'll come to that later, but I would say stem cell therapy is the fast hope which gives to the patients, I mean very unfortunate patients of epidermolysis bullosa, a chance for having a cure. If not cure, then at least a remissions. Another very interesting and one of the kind of fast applications of stem cell therapies had been wound healing and skin regeneration. There are conditions like leprosy or burn or diabetic wound or chronic
Mhm.
ulcers. These are the condition very refractory and very difficult to treat, and a lot of conditions like adipose derived stem cells that gives us options to treat these unfortunate case of chronic ulcers and kind of improve the wound healing. There are now exosome based treatment. Those are also gives us new options, which is I would say a little less expensive, and it can be very interesting treatment. But what you see over the social media and everything is basically aesthetic and anti-aging applications. Now this has
Mhm.
been really been used a lot, that rejuvenates our skin. That is the options we are having. This increase the collagen remodeling, decreases the wrinkles, and improve the hydration as a whole. So there are not only the injectable treatment, adipose derived stem cells, fat grafting, enriched ADSCs, but also there are I mean, a host of stem cell derived cosmeceuticals now available, exosome derived cosmeceuticals now available as serum forms and other things. We do not have entire data, but these are potential areas where the stem cell research are moving. Last but not the least, where we found extensive applications of stem cells is in hair regeneration. Now, stem cells
Mhm.
conditions median and ADSCs, stimulates hair follicle, and that has a very interesting application in androgenetic alopecia.
Great, great. Thank you so much for actually giving us an insight and highlighting the two, three major dermatological diseases where actually patients can benefit from stem cell therapy and this approach. Now, coming to Dr. Disha, if I may ask, where does the Indian clinics and the practicing clinicians, where do all they stand in comparison to the West when we are discussing implementation of such modern technologies? And do you feel there are any challenges that come along this way?
So, yes, this is important. See, basically, in the West, everything is regulated by FDA. So,
Yeah.
this is good because the main thing is the infrastructure, the difference in infrastructure. In the West, they have conducted large scale randomized control trials. They have data on a large group of patients. So they have more real world evidence on efficacy, long term safety. In India, what happens is that our data is mainly based on small trials. So I'll
Mhm.
say the challenges in India are that getting that ethical approval, the safety evaluation, a standardized protocol. So that is the main challenge. So what we can do is that to partner with more industries, to expand our trials. This way, it gives us a lot of hope. It's definitely exciting. So let's see where it goes.
So now, Dr. Abhishek, if you can just specify two, three major dermatological diseases where actually patients can benefit from this technique and approach.
So it's kind of my field of research. So I would say there are two conditions where I find stem cell research as a really interesting pole positions. One is
Mm-hmm.
atopic dermatitis, very close to my heart. Now, people who do not know what is atopic dermatitis, it's a very common eczematous conditions. But basically, three things happens. One, there's a rash, there's an itch, and also there are barrier dysfunctions. So there is an immune dysregulation, and also there's a barrier dysfunctions. Mesenchymal cells and adipose derived stem cells kind of do both. They regulate the dysregulated immune functions, and also improves the barrier functions. So it has an impact on all three parameters: the rashes, the itches, and the dryness of the skin. So it can be a very interesting treatment in future and in coming decades for the patients who has a very intractable itch with the atopic eczemas. Another thing where we found almost no treatment, that was epidermolysis bullosa. Now there are a lot of types of epidermolysis bullosa, but most important and most disturbing type of epidermolysis bullosa is basically epidermolysis dystrophica, which is the deepest variant, and it's a defect in the genetic defect of the collagen 7. Here also, induced pluripotent stem cells has found its applications, and the initial trial shows that you can induce remission with that. We do not know the long term efficacy of the treatment. This is a very early trial data, but in case of epidermolysis, we almost didn't have any treatment, and stem cell treatment are giving the fast hope of some kind of cure, if not cure, a long term remission for these unfortunate patients.
Great, great. So it is an upcoming field where actually application of such modern technologies is going to benefit a lot of people. Now, again, Dr. Disha, if you can just give your message for students or researchers as well as clinicians in regards to ethical investigations, regulatory considerations, and even the ethical implications involving stem cells in dermatology.
So, for students, first I'll say that understanding what a stem cell is, the immunology, the biology behind it, this is the first thing, to understand the science of it. Next is that students in our generation, we are very good, supposedly good in networking and collaboration. So, to collaborate with other fields like immunology, molecular biology, this will definitely help. Mm, but for researchers, for clinicians, I'll say that staying up to date is a very good thing, very good idea. But while all of this is very exciting, the number one thing is patient safety. So taking care of the patient is our ultimate goal. So that must always be in mind. So this is where the challenge comes. That's why we need more data, we need more trials, we need more better protocols, better evaluation of long-term safety, as I was saying. This is the main area.
Great, great. So, lastly, Dr. Abhishek and Dr. Disha, both, if you can share, how has your experience been in publishing with the Indian Journal of Skin Allergy and along with Scientific Scholar? How has your experience been? If you can just share, Dr. Abhishek.
I've been associate scientific scholar for quite a while now. I'm also part of the editorial board of a couple of journals, and that's why I've been kind of associated. And Sani and other people know me for like decades now. So thank you for the excellent platform you give as far as the editorial team is concerned. Now I'll talk about as an author's perspective. First of all, the most important thing about scientific scholar that they have this. Very rigorous peer reviews, and they keep a very high standard for journal publication, and that's so important because we see so much of spurious journal here and there. So once it's a scientific scholar journal, we are kind of assured that its quality is very high, and this has been taken seriously by everywhere in the world. That's something important. Second thing about especially the Indian Journal of Skin Allergy, I must say the editorial team is excellent. They have been very proactive. They have given a lot of tips, and in fact, the editor herself has been kind of giving us a lot of interesting and very important inputs, which actually made our manuscript even better. And Disha have been uploading all the publication in IJSN, other scientific scholars journal, so you can talk about the smoothness of the process altogether.
Yeah, so as a young researcher, what happens is that what I want a fast decision, that whether my article is rejected or accepted, so that I can send it elsewhere or move forward. So this is is very good that IJSA gives a fast decision, number one. Second is, see, we don't have that much funds. We can't afford article processing charges. So
Mm-hmm.
IJSA doesn't have that, and Scientific Scholar doesn't have that mostly. And best is that IJSA is open access. So this is also very important for us. We want to be seen, we want to be cited, so we want more our article to reach more and more number of people. So
Very
I
true.
think these are important for me.
So one interesting example, one of my article in IJSA and this thing in Scientific Scholar that has got in the very first year of publication that has got 31 cited, which is kind of extraordinary for any publication, and that's something is kudos to the how you maintain an open access journal in today's world where almost every journal asks for a fees. That
Mm-hmm.
is extraordinary. Thank you for that.
Great, great. Thank you so much, Dr. Disha and Dr. Abhishek, for joining us today at Medical Dialogues and talking about your recent review. And thank you once again for being a part of this.
Thank you for
Our
having us.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.